Our presentation will discuss the health issues of depression and anxiety revolving Arabians, featuring Egyptians of the LGBTQ youth community with a comparison to Arabians with disability. Arabians or Arabs, including Egyptians who are part of the lesbian, gay, bisexual, transgender, and queer LGBTQ community, are more susceptible than individuals of the heterosexual community to suffer from mental illness, especially anxiety and depression. Various studies analyzed statistics comparing the two groups, revealing that the LGBTQ Arabian community were 1.5 times more likely to suffer from a mental illness. These statistics can be a result of various factors affecting this community, including discrimination, cultural and religious views and values, and an overall absence of knowledge. Various health needs are required to battle the effects of negative mental health for Egyptians and overall Arabians from the LGBTQ community. Findings from a systematic review encouraged the idea of health services assessing this population group and their mental health and increasing their overall success in accessing services. Incorporating information regarding sexual health and healthcare may encourage the Egyptian and Arabian LGBTQ community to access health services and will allow them to gain the same amount of knowledge as the heterosexual community. This will also be particularly helpful for younger communities. By integrating this information within schools, the youth aged between 13 and 24 can gain knowledge early on and prevent the thought of abnormality from seeking knowledge. Another systematic review examined the importance of social inclusion for the LGBTQ communities in countries such as Egypt to avoid detrimental effects of depression because of social exclusion. To encourage this, programs in schools for youth are needed to educate this community on gender and sexual themes, as well as building relationships and to gain a sense of belonging. Furthermore, these empirical studies have made it evident that the social inclusion of the LGBTQ community throughout the healthcare curriculum is essential to battle the effects of depression on Egyptians and the overall Arabian community.
An individual's sexual orientation is a substantial and core part of one's identity. Moreover, facing any forms of discrimination, violence, or abuse is distasteful. The connections between the past and present states of recognition and acceptance of the LGBTQ plus community are evident within history and today. Australia put forth an act that provides individuals within the LGBTQ plus community with rights and protection against discrimination and abuse, which was known as the Sexual Discrimination Act in 1984. However, regardless of this act, there are many ways that individuals within this community still to this day face forms of harassment, obvious acts of prejudice, and discrimination. The factors that comply with these ideas include culture, religion, and generalized societal stigma. Within cultures such as Arabian Egyptians, the culture itself derives from countries such as Saudi Arabia, which is lawfully and societally run by religious ideologies. Therefore, the stigma surrounding the LGBTQ plus communities is exponentially larger within Arabs, as within their growth as individuals, their religious values are strongly instilled from a young age, either by their elders, society, or government, furthermore creating generational consequences within our youth. The evident hostility and stigma that surrounds LGBTQ plus individuals are prevalent due to systematic discrimination throughout history. It is especially apparent now in areas such as healthcare, which is a core part of an individual's human right. Due to this, despite the laws being placed in Australia to protect the LGBTQ plus communities, they are still constantly falling victim to forms of abuse, moreover leading to serious health issues such as depression and anxiety due to symptoms such as alienation. Simultaneously, these reasons prove to be vital to change and support to be evident within this area of issue. By implementing a more supportive and inclusive environment, individuals will be more open to seeking care and providing a positive outcome within their healthcare aspects.
Severe factors that can influence the experiences of LGBT community Egyptians in Australia when accessing healthcare, attitude toward homosexuality can create barrier for the LGBT community in accessing healthcare in Australia. Difficulty in communicating effectively with healthcare providers due to the language barriers and limited English. LGBT community may face stigma and discrimination from healthcare providers, causing reluctance to access health services. Lack to access to culturally appropriate healthcare services can impact the experiences of the LGBT community. Poverty, homelessness, and social isolation can impact the ability of the LGBT community to access adequate healthcare. Laws and policies that discriminate against the LGBT community can create barriers to accessing healthcare. Laws and policies that discriminate against the LGBT community can create barriers to accessing healthcare services. Facing mental health challenges such as depression, anxiety, and stress can impact the experiences of accessing healthcare. Healthcare providers may lack the cultural competency to understand and address the unique health needs of the LGBT community. These barriers can make it difficult for the LGBT individual to access inclusive healthcare services, leading to the disparate in health outcomes to access to cares. It is important for healthcare providers and policymakers to be aware of these barriers and work to address them to ensure that all the individuals, regardless of their sexual orientation or gender identify, have access to appropriate and inclusive healthcare services.
Depression and anxiety are two of the most prevalent mental health issues encountered by people worldwide. These issues can affect anyone regardless of background. However, certain communities are proven to be more vulnerable due to their unique history, tradition, and cultural belief. Both disability and LGBTIQ Arabic Egyptian group faces significant social stigma and discrimination, which is one of their most prominent similarities. This can result in feeling of loneliness, low self-esteem, and alienation, and which are all symptoms of anxiety and depression. This stigma can come from a variety of sources for Egyptian and Arabic LGBTQI groups, youth in Australia, including family members, friends, and larger community. This may result in feeling of rejection, isolation, and lack of understanding and support. In addition to make it difficult for these individuals to form close relationship and locate support network, the lack of acceptance can increase their mental health issues. Similarly, Arabs with disabilities frequently faces discrimination and exclusion, especially in the area of employment, education, and services access. This can result in a lack of autonomy and independence, leading to feeling of helplessness and despondency. The inability of this individual to fully participate in society can also result in feeling of alienation and a lack of purpose. Both groups faces difficulty in gaining access to mental health services, which is another similarities between them. For LGBTQI Egyptian Arabic youth, this can be result of a lack of understanding and sensitivity on the part of mental health professional or the fear of being judged or rejected by those they seek assistance from. For Arabs with disability, this may be the result of a lack of accessible service or a failure to recognize the unique obstacle they face in managing their mental health. In conclusion, the experience of depression and anxiety of LGBTQI Egyptian youth and Arabs with disability are in many ways comparable. Both groups are subject to significant stigma, discrimination, and marginalization, which can result in feeling of isolation, low self-esteem, and lack of support. In addition, they both have difficulty going to mental health services, which can increase their mental health issues. It is crucial that society should recognize the unique challenge faced by these groups and take action to address so these individuals can receive the support and resources necessary to manage their mental health and living a purposeful, meaningful life.
We live in a world where we are constantly on the move and put under pressure to remain constant with social norms. Factors in life such as work, family, and lifestyles are contributors to the increasing percentage of mental health disorders. However, studies show that individuals who participate in physical outdoor activities may see a decrease in mental health disorders, primarily depression and anxiety. As such, it is important that our feet are healthy in order for them to function properly as well as navigate us. As well as certain emotional disorders can magnify the person's ability to perceive pain. Anxiety and depression are often a cause of foot and ankle pain, or they can exacerbate true physical symptoms.
Section 1.18 of the Podiatry Code of Conduct states the importance of providing good care by assessing their psychological history on top of their physical and referring to another practitioner when needed. Section 3.2H also encourages the significance of effective communication to avoid bullying or anything that may come off as harmful to the patient. Furthermore, podiatrists should adopt a patient-centered approach to their consultation to establish rapport and comfortability for patients suffering from symptoms of anxiety and depression. Podiatrists can learn to recognize these signs and symptoms of depression and anxiety and consult with their patient avenues for management and refer to a psychologist or other support agencies if needed. This is essential within the Egyptian and Arab LGBTQ community due to the impact of social exclusion.
Biologists can contribute to improving the experiences of LGBT community Egyptian in healthcare system in Australia in the following ways. Improve LGBT health through research and evidence-based intervention. Provide education and training to healthcare providers on the health needs of the LGBT community, promoting culture competency and reducing stigma and discrimination. Develop and implement culturally appropriate health promotions and disease prevention program for the LGBT community. Collaborate with healthcare professionals, community organization, and other to improve healthcare healthcare experiences of the LGBT community. Advocate for the policies and laws that promote equality and access to healthcare for the LGBT community, raising awareness about their unique health needs and challenges faced by the LGBT community in accessing care and working to eliminate barriers to access. By doing so, they can help ensure that all the healthcare system is currently competent and accessible to everyone, regardless of their sexual orientation and gender identification.
Within clinical and professional settings, it is vital to create environments where inclusivity is prevalent. Personally, within my chosen field of study, medical science, we are taught the importance of inclusivity and acceptance of individuals. Being a health professional is also extensively written within our guidelines that we serve to provide a responsive level of care to an array of diverse dimensions. Moreover, implementing positive experiences applied to our patients, thus increasing overall successful patient-provider interactions and providing healthy relationships. Research has shown that with a holistic and non-judgmental approach, patients are more likely to understand their treatment plans and follow instructions given to them by health providers. Conclusively, by starting with a strong foundation and promoting inclusivity and the importance of non-judgmental practices within the workforce, we can produce healthy habits, furthermore lowering the chances of patients feeling isolated or judged and seeking the aid they require.
Our program is called Connect Safe, which aims to engage LGBTIQ Egyptian youth in group sessions as well as group therapy sessions that shed light on the experiences within the Egyptian LGBT community. The program will run bi-weekly for a 6-month or 12-month period, depending on the individual's needs and wants. During each week the sessions are on, there will be different activities organized to keep the sessions interactive and informative. There will be a free shuttle bus service to pick up our participants, as many of them may be under the legal driving age or have no license. As they arrive to the center, they will be greeted by our volunteers and shown where to go. The counselor for the day will go around and briefly have a chat with everyone so that they are more comfortable. The program each day will run for about 2 to 3 hours, so refreshments are provided. The participants will sit in a circle where they will do an icebreaker, providing their name, age, hobby, as well as a funny memory, so that the session starts on a positive note. Doing this allows them to form new relationships and networks. The session will then begin and it will focus on the goals of the group as a whole, as well as each participant's individual goals. Having goals allows the participants to think about what they wish to gain from the program. This then improves their chances of doing better within the program. The second session will involve another small talk about mental health to educate the participants. The second half of the session will be a psychodrama. This is where the participants can choose a scenario to roleplay about their personal experiences. This reenactment can provoke strong emotions into participants, which will then be discussed after every scene. A study in 2022 explored the effectiveness of psychodrama on patients with PTSD and depression. Both mental health issues demonstrated an equal decline in symptoms of PTSD and depression. The study also suggests psychodrama as an alternative approach to treating mental health. The center that our participants attend also has a doctor's clinic to allow for easier access to health services. Having Medicare, it will be free of charge depending on the treatment given. But having this option to attend a general practitioner's office in a space where they are familiar and safe with will encourage them to access healthcare services. The doctors in the center have received training in dealing with patients that are LGBTQ+. As many people from the community who attend other clinics are often misgendered, or in some cases, doctors have used their wrong pronouns or dead names. This causes the patient to have a negative experience with healthcare practitioners. Before attending our clinic, there will be a form that will be filled out by the participants. The form on the screen aims to improve gender diversity within healthcare settings so everyone feels included. In every third session, there will be a choice for our participants to interact with the faith leaders, as many of them may want to be a part of their faith groups but are afraid of the stigma around it. Many LGBTQ+ people are told that faith and being LGBT are not compatible. Therefore, by offering them sessions with their faith leaders, they may feel more interconnected to their faith and form connections within their faith community. Our program also has an online presence. It is a Facebook group where participants and admins can advocate for LGBTQ rights within the Egyptian community, as well as share informative news on mental health. It will also be used as a way to reach out to other patients so that they are encouraged to join, and as a means for people that are not able to attend face-to-face. This program was chosen as we believe that Egyptian LGBT youth suffering from depression can be a difficult experience for them, as their culture and their faith do not accept them being part of the community. According to LGBTIQ+ Health Australia, 63.8% of young people aged 14 to 21 reported being diagnosed with mental health condition. However, only 51.9% were treated. We've implemented a holistic approach focusing on the whole person and not just their depression. We aim to consider them physically, socially, spiritually in managing and preventing their disorder. However, regarding our minor population group, disabled LGBTIQ Arabs, the program will stay the same, but depending on their disability, we'll try our best to accommodate, for example, having a sign language interpreter, making sure they can easily access the facilities by having ramps, lower handles on the doors, and many disabled people have support workers with them. So their support workers are more than welcome to join them during the sessions. Thank you for listening to our presentation. These are our references.